Hello guys, welcome to today's presentation at Keep Calm NS on YouTube channel with me Cindy. I'm an EN BSN RN, and on this channel we discuss about different aspects of your health because it is very important. Now, if you are coming across this channel for the first time and you like the information that we are discussing, please go ahead and subscribe to this YouTube channel, like and share the PowerPoint presentation video so that you'll be notified each and every time that we post a new video. So in today's presentation, we are going to discuss about schistosomiasis, which is also called bilharziasis or bilharzia. So make sure you're subscribing, you're sharing, and you're liking this video. So to start with, let's start with the introduction. So schistosomiasis is also called bilharziasis or snail fever. It is a slowly progressive disease whose incidence is increasing worldwide. So it is most common in Asia, Africa, and South America. So it often causes chronic illness that can damage internal organs, and in children especially, it may impair growth and development. Also, the urinary form of schistosomiasis is associated with increased risk of bladder cancer in adults. Also, schistosomiasis is the second most socio-economically devastating parasitic diseases after malaria. So this simply means that after malaria, the most dangerous or the most devastating parasitic diseases that we are facing now is the schistosomiasis. So this shows how serious it is. So when it comes to the epidemiology, the disease is mostly found in Asia, Africa, and in South America, especially in the areas where the water contains numerous fresh snails. So the disease is more common in developing countries. Particularly, it's more common in children who may acquire the disease by swimming or playing in infected water. So children who live near water bodies are at high risk of having schistosomiasis or bilharzia. So now let's look at the definition. So we have defined schistosomiasis as a parasitic disease which is caused by the three species of flake of the genus Schistosomas. It is transmitted through the penetration of the syncytia into the human skin. It is characterized by mild itching on the site of penetration, abdominal pains, and splenomegaly. So this is how we can define schistosomiasis. So notice that we have mentioned the cause, how it is transmitted, and the signs and symptoms. Now let's look at the causes of schistosomiasis or bilharzia. So there are three main blood flakes of schistosomas that exist and that infect humans. So the first one we have is Schistosoma masoni. So this type causes chronic infection with regular fever, fatigue, and anemia. The second one we have is Schistosoma japonicum. So this type affects more men than women and may cause acute infection with sudden onset of fever, chills, headache, and coughing. So the third one we have, not the second, but the third one that we have is Schistosoma hematobum. So this one causes terminal hematuria, dysuria, erythrocholic with secondary infection. So this one is the one which affects the urinary system, and it's the one which increases one's risk of developing bladder cancer in adults. So now let's look at the life cycle of schistosomiasis. So the life cycle of the three schistosomas are quite similar. So as we can see from this diagram, in the first stage we have the eggs of the three schistosomas being introduced in the environment by an infected person. So we see that these two eggs are from one Schistosoma masoni, japonicum, and hematobium. So in the feces, we can find eggs for Schistosoma masoni and the eggs of Schistosoma japonicum. Then in the urine, we are likely to find the eggs for Schistosoma hematobium because it is the one which affects the urinary system. Then in the second stage, we see that these eggs, which were introduced by this infected person in the environment, they hatch upon when they become in contact with the water. So after hatching, they produce a mericidium. So this mericidium is the one which infects the fresh water snails. So when the mericidium enters the snails, it goes to undergo further development. In stage 4, we see that this mericidium develops into it undergoes further development and develops into sporozoites in a snail. So from the mericidium, we see development of the sporozoites. They are primary sporozoites actually. So this is happening inside the snails. So after the primary sporozoites, they also develop into secondary sporozoites. So these secondary sporozoites now, they undergo further development, which now produces a free-swimming syncardia, which is released from the snail into the water. So the syncardia now is the one which is able to infect a human being, or it is the one which is able to penetrate through the skin of the human being. So at stage 6, we see that this syncardia is the one which has now penetrated into the human skin. So when it enters into the human skin, so it explodes before entering into the skin. It will be on the skin exploding to find a place on the skin where it can easily penetrate. Now when it penetrates into the skin, it will lose its tail. Like for example, if we look at this, the way it's looking, this part will penetrate into the skin and this tail will remain, it will fall off. So during stage 7, we see that the syncardia loses the tail during penetration and becomes a schistosomolar. So this schistosomolar is free moving in the human body. So it goes into the circulatory system, into the bloodstream. From there, it will go through the portal circulatory system to the liver, and then it will mature into adults. And then during stage 10, we see now that these worms, the matured worms, have now paired the males and the females, and they start producing the eggs. Now let's look into this life cycle in detail. So we said that the life cycle of all the species, all these schistosomas, is very similar. So we said that during the first stage, the parasites' eggs are released into the environment by an infected individual and hatch on contact with fresh water to release a free-swimming mericidium. So after the mericidium is produced, the mericidium infects the freshwater snails. After the infection, close to penetration, the mericidium transforms into a primary sporocyte. So this is occurring inside the water snail. So once at the hepatopancreas, the germ cells within the secondary sporocytes begin to divide again, with this time producing thousands of new parasites. So this is like the sexual part of the reproduction of these parasites. So we see that from the primary sporocytes, they start producing asexually to produce thousands of new parasites. And we should always remember that this is happening inside the snail at the hepatopancreas. So these new parasites which are produced are the ones which are known as the syncaria, which are the liver capable of infecting the mammals. So during penetration, so this syncaria is the one that is going to enter into the human skin, as we discussed when we are looking at the diagram. So the penetration of the human skin occurs after the syncaria has or have attached to and explode the skin. So they don't just enter direct into the skin, they'll move around and explore how good the skin is in order for them to find a part where they can penetrate at. So when the syncaria penetrates the skin, it transforms into a migrating schistosomal stage. So once the syncaria enters, remember that the head part is the one which penetrates to the skin, then it sheds the tail, then that syncaria now transforms into the migrating schistosomal stage. So that schistosomal may remain in the skin for about 2 days before locating to post-capillary venules. So from here, the schistosomal travels to the lungs where it undergoes further development. So the schistosomal will be passing through the capillaries, through the portal circulation, and that's how it will go to the lungs to undergo further development. So when they have developed now, we see that after 8 to 10 days after penetration of the skin, the parasites migrate to the liver sinus cells. So this is where they also undergo further development, and they actually mature into bigger worms which are able to produce eggs. So the newly mature worms pair, longer females with shorter males residing into the gynecophilic channel. So it will appear like this. So the large one is the female worm, and the smaller worm is the male worm. So the adult worm are about 10 millimeters strong. So this is how they look. So worms pair of the Schistosoma masoni and Schistosoma japonicum ultimately migrate from the liver to the perivesical venous plexus of the bladder, the ureters, and the kidneys through the hemorrhoidal plexus. So this is where now they go to reside. So the parasites reach maturity in 6 to 8 weeks. At this time, they begin to now produce eggs. So we've seen how these worms will enter into the body, undergo different stages of development, and then they become mature within 6 to 8 weeks, and then they begin to produce the eggs. So adults Schistosoma masoni pairs resulting in the mesenteric vessels and produces up to about 300 eggs per day during their reproductive lives. So you see that in the mesenteric region, we also can find this Schistosoma masoni, which is capable of producing about 300 eggs per day. Now imagine one person having all these worms' eggs. Then Schistosoma japonica may release or may produce about 300 eggs per day as well. So this is how the eggs are going to look like under a microscope. So many of the eggs pass through the walls of the blood vessels and through the intestinal walls to be passed out of the body through the feces. So for Schistosoma masoni and japonicum, the eggs are going to be released through feces or stool, while Schistosoma hematobium eggs are going to be passed on through the urethra or the bladder wall, and they'll be found in the urine. And worm pairs can live in the body for an average of 4.5 years, but may persist up to 20 years. So when these worms are not treated, they are not managed, they can live in a human being's body for about 20 years. So now let's move on to look at the signs and symptoms of these worms. Now remember that these worms are in the, most of them are in the urinary system for Schistosoma hematobium, and the other schistosomas are in the GIT. And we know that digestion takes place in the GIT, which is a very much important aspect of our bodies. So when these worms are in the GIT, it means they are also disturbing the normal functioning of the GIT. That is why these worms can cause growth impairment and underdevelopment in children. So now let's look at the signs and symptoms. So the signs and symptoms are as follows. The patient will present with abdominal pains, diarrhea, eosinophilia, which is simply the increase of white blood cells, fever due to the presence of these parasites in a patient's body, fatigue, hepatosplenomegaly to the presence of these parasites in the liver and in the spleen. Then skin symptoms include mild itching and a popular like dermatitis at the feet or other parts after swimming in the water containing this scaria. So this will happen when the scaria has penetrated through the skin. So there will be some kind of inflammation, which is itching, and some kind of dermatitis at the site of entry. Then occasionally they can be central nervous system symptoms. So this may occur, there may be central nervous system lesions which may occur, and cerebral granulomas disease may occur due to the presence of these eggs and the parasites affecting the central nervous system. Then we can also have portal hypertension with hematemesis and this splenomegaly. This can be caused by Schistosoma masoni and Schistosoma japonica. Then we can have also cystitis and uretitis due to the presence of Schistosoma hematobium in the urinary system, which may be accompanied with hematuria. So this is what can progress to bladder cancer in adults. Then we may also have portal hypertension due to Schistosoma masoni and Schistosoma japonicum, also glomerulonephritis and central nervous system lesions may also come about. So those are the signs and symptoms of bilharzia. So now let's look at the management. Starting with the medical management, we'll start with the investigation. So first and foremost, history taking may review the predisposing factors, such as maybe this patient coming from an endemic area or an area where there is a lot of water bodies, or maybe these patients are coming from areas where they are able to swim and get water from the water bodies, such as the rivers and the swamps. Then also we can do a microscopic examination of the eggs which may be found in the stool or the urine. So this is the most practical method of making a diagnosis. So a sample of stool and urine will be taken from the patient for microscopic examination. Also tissue biopsy can be done. So electrobiopsy for all the species and biopsy of the bladder when the stool and the urine examination have failed. So when the stool and the urine shows no egg or no these worms, we can also do the biopsy of the rectum or the bladder for identification of these eggs on the biopsy. So when it comes to treatment, the antiemetic drug of choice is the plasquental. So this can be administered as follows. So the dose is 25 mg per kg body weight, which can be given every 4 to 6 hours, 3 times a day as a one-day treatment. At the interval not less than 4. So it can be given every after 4 hours or 6 hours as a one course treatment. So when it comes to the nursing management, so the patient will present with the following problems, and the patient should be nursed according to the problems that they have. So the first one will be altered nutrition based on body requirements. This is due to the presence of the parasite in the GIT. Fatigue, this is due to the presence of the parasites in the body. Diarrhea, also due to the presence of the parasites in the GIT. Hypothermia or fever is because of the presence of the parasites in the body. Altered comfort, which would also be said to be pain due to the presence of these parasites in the GIT. Also, there can be fluid volume deficit, which would come about due to diarrhea. So now let's move on to look at the complications of bilharzia. So other complications, we have portal hypertension, hepatosplenomegaly, pulmonary hypertension, ascites, hematemesis from ruptured esophageal varices. The urinary obstruction and hydronephrosis can come due to schistosoma hematobium. So when it comes to giving IEC, that's information, education, and communication to the community and to the patient at large. So we need to explain the medication regime to the patient. So the patient should understand how the medication is going to be administered. If it's the child, make sure that the parents understand how we are going to be administering these drugs. Then also inform the patient on the need to follow up. So after discharge, patient should come back for review. So then we should also educate the community and the people to avoid swimming in contaminated water. So if the community are aware that this water in this water body, maybe the river or the swamp, or maybe the swimming pool is contaminated, they should avoid swimming in there to avoid schistosomiasis or bilharzia. So if patients live in an endemic area, explain the importance of purifying water. So also we want to make sure that we discourage defecating in the water bodies, because from the life cycle, we have seen that these eggs are going to be introduced in the environment by the people who are infected. So the people who have these parasites and these eggs into their bodies, when they defecate in the water, they are going to be infecting this water. So we want to make sure that we discourage people from defecating in water bodies. Also, if patients, yes, we have also looked at this point, the importance of purifying water and avoiding water which is contaminated at all. Then we also want to teach children to avoid urinating in water, because remember that for schistosoma hematobium, the eggs are going to be passed through the urine into the environment or the water. So we want to make sure that we discourage people from urinating in the water. Then we also want to encourage the use of petri cleans. So we want to make sure that in the communities, people should build petri cleans that are nidificating in the environment, because that will cause infecting of the soil and the water. Yes. Then we also want to make sure that we discourage the use of human wastes as manure, because it can cause the easy transmission of bilharzia. Then another thing is that we want to make sure that we deworm the children. So children should be dewormed against all the type of worms. So this is where our presentation ends. I hope that you have gotten one or two things. So please make sure that you like, subscribe, and share this PowerPoint presentation video. Thank you so much for listening. Wishing you the very best in your studies. Thank you.